We're going to bring in right now Dr. Scott McFarland, Medical Director for a hospital, and also Nick Tate, who's the author of the best-selling Obamacare Survival Guide. We were just talking about this, Dr. McFarland, in the break. You have a very specific story on why this is so important. Please share it with us.
We treat stroke aggressively more so now than ever before. Stroke used to be, oh, grandma had a stroke and there's nothing we can do, poor grandma. Now with immediate intervention, we can completely reverse the effects of a stroke. We had a 79-year-old lady sitting at dinner with her family a week ago Friday night. Quits talking. I said, Grandma, you all right? No response. She's awake, completely alert. They called the paramedics. They brought her to the hospital within about 14 minutes. We took her to a CAT scan. We have a neurologist in hospital because the paramedics called, alerted us. He meets her at the CAT scan, decides she's a candidate for TPA, tissue plasminogen activator, the clot buster drug. 21 minutes into this, into her time in the hospital, the TPA starts. 35 minutes into it, her symptoms are completely resolved. She was so desperate, she's like pleading with her eyes. She can't talk, and you can see the tears in her eyes welling up. She could not communicate.
You can only imagine how horrifying that would be. Nick, you had, you cover health a lot closer than I do, and you had a specific question for the doctor as well.
Well, it seems to me that the more we find out about stroke and heart disease, symptoms are very different. They're not the same. It seems to me one of the trends in medicine is identifying those specific indications, those specific symptoms to individual patients. But do you see that in your practice, some of the differences in the ways that men and women present with stroke?
Certainly in heart attack that's true. With stroke, if you have weakness in your face, inability to speak, numbness or weakness on one side of your body, that implies a deficit of blood flow to the opposite side of your brain.
Now, we were also talking about the increased awareness about strokes, particularly with women. What would have happened in the same situation, say, 10 years ago?
10 years ago, it would have been call a nursing home. You know, she's now condemned to like some sort of perpetual care in a nursing facility. And now she's back home, literally 3 days later, asymptomatic, an aspirin a day to minimize the potential for blood clotting.
Amazing, and for anybody who has a family member or knows somebody, a loved one who's had a stroke in the past years ago, you lose that person. Even if their mental capacity is there, their speech is gone a lot of times. They look differently and they're not the same person.
It is so tragic. We restored her. I mean, and just the look on her face when she could speak 35, 40 minutes into this, it was, I still get tingles just thinking about that moment when she first spoke. It leaves me speechless.
Wow, well, thank you for sharing that story. You know, while we have you here, Doctor, we touched on this briefly last time. About what you're seeing in the emergency room. We heard Senator Chuck Schumer kind of flaunt the fact that there are fewer people going into the emergency room. You haven't seen that, correct?
Not at all. Particularly during flu season, we see innumerable people. There are reasons, though. There's, I think, more awareness now of urgent care. It's sort of a little more cost-effective option. Not always the best option if you have a stroke, you know, or a heart attack.
Right.
They can't be quite as comprehensive in their care. The scary thing I heard was that people are now either working less or not working at all in order to qualify for subsidies. Mm-hmm. How sad is that, to disincentivize people to work?
Yeah, and exactly the opposite effect that they were hoping this was going to have. And Nick and I were just talking about these doctor shortages. In particular, you would have normally on a health care plan about 40 cardiologists for every 100,000 patients, but as some of these Obamacare plans, it's now just 15 cardiologists. You know, as somebody who's kind of a doctor of last resort, when somebody comes in with a stroke or a heart attack, how concerning is that for you that there are, you know, the number is so much smaller for these people for a specialty like cardiology?
It is. You know, the emergency department is like the last refuge of American healthcare. It is the safety net. That's where people go when they have no other option. Every day I see people come in who said, "Who's your cardiologist?" "Well, he just removed my plan. I'm trying to find another one."
Every single day?
Every single day. Somebody has lost their doctor because of a plan change, or the doctor's been excluded from that care.
So the ER is not necessarily a venue of last resort. For many people, it's a primary care facility.
Absolutely. We're episodic, catastrophic care. You know?
Well, you know, the argument for Obamacare is that it would reduce the number of people in ERs. And they would see a doctor, they'd see a specialist when they needed to, they'd get the primary care. But in fact, the studies that have shown what people do, those old habits die hard. If you've been getting good care in the ER, and many people do, you'll keep doing it regardless of whether you have health insurance or not. And as we suggested, I think, as you're seeing, people continue to use it for primary care for different reasons perhaps now than a year ago.
So the adverse effect of what they were hoping for, more people coming to the ER, we don't know exactly why, but we know that the reason why there are not fewer people coming in, they can't attribute it to Obamacare. What other side effects are we seeing in the early stages here of Obamacare as it takes hold in the emergency rooms across America?
The early side effects. We're seeing a lot of people still, because of the immediacy of the care. We have emergency physicians are no longer like moonlighters. You know, they're specialty trained for the last 30 years. I mean, so this is what we do. We treat heart attacks and strokes, but we also treat sore throats and ankles.
Yeah.
And particularly in South Florida, you know, it's a Florida law. We cannot deny anybody care. Urgent cares, however, can say, sorry, no insurance, no care, you know, if you don't pay for it up front. But I'd say more and more and more people, particularly, this is the saddest part, probably more drug abuse now than I've ever seen in the last 30 years.
Why do you think that is?
It's an anxious world, saturated by news media, you know, problems presented to them for which they have no answers. So we're seeing more and more people coming. The black tar heroin is big now.
We covered that last week here on the show. With Philip Seymour Hoffman's death. You bring that up, and it's interesting. I read a quote from Aaron Sorkin, the TV producer and writer, who said that Philip Seymour Hoffman's death maybe have prevented 10 others because it brought so much attention. Do you believe that might be the case?
I'm hoping that right now, just watching this program, that people learn a little bit, you know, just a little bit of preventive medicine. They get a few clues as to how they can avoid catastrophes. In the ER, we're catastrophic medicine. It would be so nice to be part of something that helps put out the fire before it gets started.
A lot of it's prescription drug abuse as well, too, isn't it?
Absolutely.
It's not just heroin.
People are making their own crocodile made from, it's a Russian word.
Yeah, we've heard that. This is, was kind of tied, I think, to that case of a suspect biting another suspect down in Miami. Right. Biting another suspect down in Miami. Right. The synthetic drugs we talked about. Clearly there's been an impact in emergency rooms because of Obamacare. A couple other health-related topics to discuss while we have you here, Dr. McFarland. This is interesting, especially for milk drinkers who love the good stuff. We're talking about the vitamin A and D milk, not the skim, not the 2% milk. A new study says that people who drink full-fat milk might be thinner than folks who drink skim milk or 2% milk. Why do you think that is?
I would think the more it mimics the natural product, the better off you are, without artificial ingredients, which are somewhat tantamount to poisons.
Yeah, I guess it's good news because it certainly tastes better, right?
It tastes better. I don't know if there's a weight issue involved, but the skinnier, it's amazing because you need the fat. Your body needs a certain amount of fat. You can't live a fat-free life.
And Nick and I were talking about that as well. Nick, go ahead.
So many of the things that we once thought were, dietary evils. Let's go down the list. I mean, chocolate, eggs, milk now,
red wine,
full fat dressings, and the more research that's being done.
Hungry and thirsty just thinking about it.
the more research is being done, the more it shows that in fact those products that are pure, whole, real foods are better than some of the artificial substitutes. And I don't know what your view is on this. I'd be interested, but my feeling is that everything in moderation.
Almost everything
in moderation. If you're consuming in moderation, you're going to be doing yourself a world of good, as opposed to garbaging up on. You can eat a whole bag of fat-free, low-fat, low-cal chips. That's not a healthy choice.
Yeah, and back to the full-fat milk thing. We've also heard about it's better for women too because it helps them absorb calcium. Is that true, or is that just more medical information that's out there?
Probably untested, but the vitamin D in the milk, still has to be activated by sunlight. So vitamin D in and of itself does not provide a nutritional supplement.
Okay, and last topic real quickly to discuss, I guess there's some more information too about, we're going to come back and get to that in a second, and that is, we'll talk about mammograms and the correlation between whether or not they're actually reducing breast cancer, helping women survive breast cancer. That and more when America's Forum continues here on Newsmax TV right after this.